Can't stop peeing at night? Let's fix that. Here are 4 ways to help you get a peaceful night's rest. Number 1, try drinking water earlier in the day. You can still have lots of water if that's what you do throughout the day, if you're a big water drinker, which is great. Just shift your water intake a little earlier in the day. If you go to bed at 10 o'clock, try to stop drinking and eating about 6, 7 o'clock. You want to stop eating and drinking about 3 to 4 hours before you go to bed. So the goal is to have 8 hours or however many hours of peaceful sleep. You don't want to be getting up in the middle of the night to go to the bathroom. This is allowing your bladder to wake you up. You're training your bladder to wake you up. And you want to train your bladder to stay quiet throughout the night. Right? Your brain knows that you're sleeping. Your brain knows that you shouldn't be getting up in the middle of the night to go to the bathroom. So when we respond to that signal from the bladder that there is fluid in the bladder, which is fine because the job of your bladder is to store urine. So it's okay that there's fluid in there. Just ignore the signal, really. Your brain knows that it's not necessary to get up. We behaviorally decide to get up and go to the bathroom. So I want you to try to focus on the goal of sleeping 8 hours a night. And the easiest way to do that is by trying to not have your bladder full when you go to sleep, right? So shift water intake earlier in the day. Try to stop eating and drinking about 6, 7 o'clock if you go to bed at 10 o'clock. So 3 to 4 hours before you go to bed. Number 2, drink more water. So maybe you drink a lot and you think like, I drink 8 glasses of 8 ounces of fluid a day, but it's like coffee and beer and wine and iced tea and all of these things that are just not good for your bladder. The best thing that's good for your bladder is water because it's flushing out your bladder and it's keeping your bladder lining healthy, right? The more bladder irritants that you drink, the more that your bladder is going to fire off these signals saying that you have to go to the bathroom, even when you don't have to go to the bathroom. So anything citrusy, anything acidic, anything carbonated, anything caffeinated is really going to irritate the bladder, make you feel like you have to go to the bathroom when you don't have to go to the bathroom. So more water. If you have a glass of water on your nightstand at night, which a lot of people do because they feel thirsty, number 1, you need to, again, drink more water throughout the day so you feel more hydrated. And also you can get a humidifier. A humidifier can help moisturize the air so you don't feel like your mouth is dry when you're sleeping. You don't feel like your airways are dry. So try to get something like a humidifier to humidify the air so the air doesn't feel so dry that you need to get up and drink. Number 4, I know this is going to be hard, but when you get that signal from your bladder that there's fluid in the bladder and you need to get up and go to the bathroom, just ignore it. I know that's so hard, but if you feel like you have to go and you get up and go, then you're building a habit, right? You're creating a habit. You're training your bladder to wake you up. So try to ignore that signal that you don't get up and go to the bathroom in the middle of the night because then you start going more and more. You build that habit, you start getting up throughout the night, and then you're super tired during the day. So try your best to try to ignore the signal. And all of these it's a goal. These are all behavioral changes to develop better habits so you have peaceful night's sleep. It's training your pelvic floor and training your bladder to relax and give you a full night's sleep. So for more tips, talk to a pelvic floor physical therapist about how to have a healthy pelvic floor and healthy bladder habits. Also, subscribe and follow for more.